everything that makes us, everything that makes me comes from within, comes from genetic expression. Give her a wrinkle there, make the hair grow with ice cream, as you said, go grey. These are the messages that our genes are sending out. And we know that stress has an impact on that genetic expression, and so do the relaxation techniques like diaphragmatic breathing and guided imagery.
Dr. Judy Lovas, thank you so much for joining us here on the Science of Psychotherapy podcast. It's so great to meet you.
Thank you, and you too, Matthew. Thank you very much for the opportunity.
And of course, Richard here. Lovely to see you again. Judy, it's been a while, but we've caught up with each other over the years, and it was fabulous, Judy. I get the emails from Sydney University because I'm an alumni, and there was you front and center with a new course coming up, and we want to talk about that with your wonderful work with relaxation and the interrelationship of that with science, the PNI, the psychoneuroimmunology. But can you just give us a bit of background? We've introduced you slightly, but just a bit of an introduction for the listeners as to sort of who you are, how you've got yourself to this place now, because you've been doing this stuff for a while, and so you're, in my mind, you're one of the national experts in this.
I have been doing this for a while, and got to the point where I thought, well, actually, it's closer to 30 years than 25, but I still dare not say 30 years. This has certainly been an evolution, and one that I've had periods of huge frustration because of the slow progress. Coming across the area of psychoneuroimmunology many years ago, when it was not so much in its infancy, but still a very new area of research, and understanding that it's relevant to everything that I had done up to that point in terms of both psychology and massage therapy, and seeing from many years of clinical practice and teaching in massage therapy that people come for pain, people come for stress management, and so much of what dictates our health comes from stress, and the interrelationship between things like pain or psychological conditions and stress. So it is quite a landmark event to have a short continuing professional development 6-hour online course at the University of Sydney. But I have been running short courses in PNI and in relaxation therapy for that whole time, at various levels for different health professionals, from yoga teachers to psychologists I've had psychiatrists and now GPs coming. There are a lot of dentists booked into this latest course. The interest is there, but as you said, it's taken many years to really, someone said the other day, it's now undeniable that the essence of psychoneuroimmunology from a scientific perspective cannot be debated, that what we understand the mind to be is not just linked, but virtually the same, one and the same as the body. It's wonderful, you're both nodding. So.
Yes, no, but it is so much, Judy. I've been fortunate to be mentored by a lovely man named Ernest Rossi in America, and I was talking to him about these sorts of things some years ago, and Ada, of course, who was there, and he said, "Oh yes, well, when we were talking about these guys who and women and men." Who were these originators who all chatted with each other in the 80s and 90s. But it has been up to people like you and now we're sort of joining in, trying to do it with our new book, trying to show the whole system is relevant. And I think Dan Siegel did it nicely when he said the mind is this property of the whole body rather than just mental, brain activity. But give us a little bit of an insight in there. But I can see you champing at the bit. I just wondering if
I just wanted
background.
just to step back a little bit for those that are not familiar with the term psychoneuroimmunology. I mean, I was reading about this in the early 90s when I was actually at a conservatorium studying music. So, but I'm sure there's a lot of people that, this may be a new term. So if we can sort of, just lay a bit of a foundation would be great.
And fascinating that, psychoneuroimmunology, PNI, can be related to music, to art, to play therapy, to psychology, to sports. So psychoneuroimmunology, at its barest, simplest, most basic definition, is the study of interactions and the communications at a cellular, molecular level between 3 of our bodily systems. We have about 11, and PNI focuses on the communications between the nervous, endocrine, and immune systems. And these systems, PNI was born out of a study in the early 70s, published in 1975 in the Journal of Psychosomatic Medicine, where an immunologist and a psychologist did an experiment on rats and found that there was a relationship in terms of a communication between the nervous system and the immune system. And they actually saw it within an experiment. And that was Robert Ader and Nicholas Cohen, 2 of the granddaddies or godfathers of psychoneuroimmunology. And they were really the first to do proper research, proper studies. When I say proper, scientific studies. And it was Robert Ader who coined the phrase psychoneuroimmunology. From there, since 1975, and it's a great, you're talking about from the 90s, but it really started. PNI was born in the 70s, and it's grown, and it's now grown at an exponential rate, whereby the research is becoming more sophisticated as our lab techniques improve and as our understanding changes. So do you want me to keep going? I could keep going.
No, that's a good intro. And it's interesting that it was that far back too, because in the early 90s when I was reading, it was like revolutionary, sort of new stuff, but obviously
not. Only 20 years old, but it was revolutionary.
Yes, and it continues to amaze me how slowly our thinking changes, and some things that we think are revolutionary, has been documented for half a century. But anyway,
well, there is, when you say documented, first of all, PNI is based on the essences of traditional medicines. So the classic, whether it's Greek, Hippocrates and Galen, whether it's Ayurvedic Indian medicine, traditional Chinese medicine, indigenous traditional medicines, none of them work from a reductionist dualism, where you break down the body and the mind and you deal with one little component.
Yep.
All these ancient approaches to healing, to health, to medicine were holistic, and words have been bandied around, and some words are heavily weighted with different histories, but the term holism means looking at everything as an entire unit, and that was always done up until the Middle Ages. And the history, I personally believe that the history of medicine should be taught in every single health and medical degree course,
Yeah.
It is fascinating, and I think it's critical to understand we are where we're at in the 21st century because of what's been before us. So given that I have time, it depends on the duration of the course and the audience, I talk briefly about the history of medicine in the Middle Ages, that mind and body was split by the church on purpose. And modern Western medicine has had to deal with the consequences of that until 1975.
Right.
Yes, it's so interesting. I mean, it was sort of, we got into this habit of isolating elements, which is actually fine. I mean, we talk about this when thinking in complex systems. Pridgegine said the value of differentiating is so we can explore the elements to discover their richness, but to put them back into the system. And this idea of fencing things off. I mean, in psychotherapy, I mean, you know, you find something that is beneficial for someone, you study it, you give it 3 letters, put a fence around it, and charge people $20 to use it. And ne'er the twain shall meet. Whereas what you're talking here about is, as you say, there's 11 systems, but we've got this particular PNI system. And the nature of it, I can only imagine, is what you're suggesting, is that it gets out of whack. It gets out of something that needs to be brought it back into something, because your work is around the usefulness of relaxation as a process to enable the PNI system to work better. What's the relationship? Actually, I'm pre-guessing. Please explain a bit more.
So I guess, you know, over the, what has it been, 1975, so that's 50 years, psychoneuroimmunology, and there are different approaches. There's also PNIE, which is psychoneuroimmunological endocrinology, or you can put the endocrinology before the immunology, it doesn't matter. But this area has, depends on who's studying it. And in fact, Robert Ada wrote a beautiful article about who and what is psychoneuroimmunology. It depends on the teacher. It depends on the audience, the participants, the students. I come from a psychology and massage therapy background, and that led me to an interest in the effects of stress on our health and well-being, both mental and physical. Other people, now there's a huge area of PNI-based oncology, looking at the way cancers develop, the way treatments can work from a PNI perspective. An endocrinologist might look at diabetes from a PNI point of view. So I've developed this niche market. I really don't know anyone else who's doing exactly what I'm doing. I mean, there are people now overseas, not in Australia, who are doing similar things. But it's looking at, okay, PNI developed originally because of observations of what stress, be it psychological, be it physical, does to us, our minds and our bodies. And then there was this natural progression. So from the 70s to the 90s or the 2000s, we looked at every kind of stress, from extreme cold weather to injury, to Alzheimer's or arthritis or different diseases, and how they are seen from a PNI perspective. And I continued along that natural progression. Okay, we know that stress is immunosuppressant. That was established without a shadow of doubt by the 90s. And the natural progression was, okay, what can relaxation do if stress is so bad for our immunity, for our neurological functioning, for our endocrinological functioning? And that's where I've gone. And that came from being a massage therapist initially, and then looking at hands-on techniques to relax, looking at diaphragmatic breathing to relax, looking at guided imagery and different evidence-based interventions that cut the circuit, cut the vicious cycle of stress, ill health, mental conditions, physical conditions, more stressful. Yeah. So
right, because it can be a positive feedback loop, right?
it is.
And
That's what it is.
And of course can be the negative feedback loop, which is when it falls apart. I mean, my wife's a remedial massage therapist, and she's also a nurse in lifestyle medicine. So like you, very, very advanced, and a mental health nurse as well. God, she looks after everything. You'd love her. But we had a client the other day who for stress, and she does it a lot. Susie does it for pain as well, which is also the stress is part of the painful experience.
Yep.
Yeah. And the client came for a massage for releasing and relieving some anxiety, and that's actually what I would have prescribed as a therapist. Don't talk to me. Go and do something physically. So when you're teaching it in the course, this work of relaxation involves another self practices. But as also interpersonal practices. What are some of the things that people can do and that you teach?
I guess the only way to teach psychoneuroimmunology informed or based relaxation therapies is to, first of all, give these, health and medical practitioners the science and the evidence. So that's the theoretical components of much of my teaching. Here's the latest evidence that shows that guided imagery has been examined on these particular biological and psychological outcomes. So that's the theory. Then there's two parts to the prac, and teaching this is truly a win-win situation for the participants. First and foremost, they need to practice what we preach. So in order to bring these relaxation skills into the clinical practice, you need to be practicing yourself. You need to be comfortable. You need to know the benefits, the disadvantages, the difficulties, the great breakthroughs, the impact of regular practice. That is the first step, personal practice. And then from there grows the clinical experience. So I talk about riding a car or riding a bike or driving a car, or using a psychotherapy intervention, or putting in a catheter or baking a souffle. It doesn't matter. In order to be proficient, you need to practice regularly. So the emphasis is on personal practice first, and then continuously, regularly, and then start with family and friends, practicing how to implement and how to teach relaxation skills, relaxation interventions like diaphragmatic breathing and guided imagery.
Yeah. Well, one of the fascinating things that I'm going back 30 years, so I can't remember, I can't recall the studies, but I do remember reading about oncology studies with children with leukemia using guided imagery, and they are imagining, their immune system being active, and that they had some amazing results. And way back then I thought, wow, this is going to overtake oncology, and it's going to be everywhere, but it's not. So
it's not everywhere, but since you read those articles, progress has certainly been made. So we have, like, even here in Sydney, the Chris O'Brien Lifehouse, which is a dedicated unit at Prince of Wales Hospital, dedicated to a evidence-based holistic approach to cancers. They have oncology trained massage therapists, they have mindfulness, they have, I don't know what else, but a range of practitioners available to the patients there. And that's run by doctors and set up by doctors. So I see here in 2023, the beginning of 2023, I see great progress, albeit painfully slow. I also believe that progress is now improving and advancing at an exponential rate. It's getting faster. It's becoming more, Do you know, I actually remember in the early 90s, when I was teaching massage therapy at TAFE, I did quietly say to the students, so quietly it would never be heard on a podcast, that we're waiting for this generation of practitioners to leave, to take their old-fashioned limited perspectives and bow out for in whatever way. And I see now, I mean, I have lots of avenues to see new practitioners, whether they're yoga teachers, psychotherapists, massage therapists, psychiatrists, and they are open. They're not just open to a holistic approach that is evidence-based, but they're embracing it.
Yes, it's becoming a more natural aspect, and certainly part of the work that Matt and I are doing, and I'm actually pursuing a PhD to now I've finally got a question, but we're talking about this going further than person-centered, going further than just interpersonal, and actually celebrating this responsiveness that can occur between people, a sort of an attuned rapport. And I think I see it most expressively in massage therapy. When Sue was talking, and she finds herself going to all different parts of the body, not necessarily under instructions of where the pain are, but in relation to the conversation between the hands and the tissue. And I think this is something that we lose as individuals. And of course, we have a lot now that's dealing with self-awareness and proprioception activities. There's a whole new thing that's coming up there, and interoception. Yeah. And how does that incorporate it in some of the things you talk about? Or is that, you know?
It certainly is. And I'll come back to interoception, but you were talking about sort of the union or the understanding and the communication for a massage therapist with the body. What excites me about psychoneuroimmunology, born from a study between an immunologist and a psychologist, is that it encourages networking. So a massage therapist will refer to a psychologist, will refer to a dietitian, will recommend an exercise physiologist. And so it goes. And even with psychiatrists and at all levels, dentists, they recognize increasingly that they deal with people's anxieties, and they need, in order to perform dentistry to the best of their ability, they need to be able to reduce a patient's anxiety. And that's where the relaxation comes in. So, you know, we talk about multidisciplinary and approaches to health and how that is represented within 21st century healthcare. And PNI is the evidence of the need and the benefits for that multidisciplinary approach. We also then, you touched on interoception. There, I'm trying to think of the researcher's name. He's American. I think it's Jerath, Jerath. He looks at diaphragmatic breathing. The other person I'm thinking of will come to mind in a second. There are two researchers I'm thinking of in these areas. They talk about interoception of the respiratory system, and we actually have multiple pathways. Like, you know that you're going to do a hiccup. That's one, you know you're going to yawn, you know you're going to sigh. They're different respiratory neurological pathways up to the brain. And they all have different influences. And some people have a better insight into them. PNI can actually, at some levels, and it depends on the practitioner, it depends on the patient, can encourage a greater interoception, a greater understanding of one's own physiology.
Right.
It's endless.
Yeah. Yeah, and it's wonderful to see then now there is more of an uptake of this, because we've seen efficacy. We've talked to a number of people about biofeedback, neurofeedback, and there's great efficacy in some of those practices. But boy, it has taken a long time
It's
for
taken far
the
too long.
yeah.
And I'm actually working with some academics at the University of Haifa in Israel, who are doing diaphragmatic breathing and guided imagery and progressive muscle relaxation with very simple biofeedback. They're the high-tech guys. So they've devised very simple application of hardware, just on your fingertip, and they can tell heart rate variability with diaphragmatic breathing, without diaphragmatic breathing. So, great advances, painfully slow.
Painfully slow.
Yeah.
It's a way. I mean, it is interesting, these processes. I did a workshop a couple of years ago in America called "Almost Everything I Know in Psychotherapy I Learned in Acting School." And largely because of the fact that acting school is a very self-awareness developing thing, because you have to learn many aspects of yourself. But of course, we learn to speak. We learn to speak properly.
Breathe properly.
Yeah, this voice was worse than this when I was younger. But also I was a singer, and this diaphragmatic breathing has been a natural part of my life since I was 13, and I started. And I remember my singing teacher would grasp my hand at 14 years of age and plunge it onto her diaphragm and breathe furiously, which as a 14-year-old boy I found very distressing. But
you should have plunged it onto your diaphragm.
That's right. Breathe. We're going back a few years when I'm no longer 14, but this is so not known, and the more we have this sitting down stuff, where we're sitting a lot for all our practices, it's harder and harder to get the diaphragm to be engaged. And you've mentioned several types of breathing. These are the things that you're teaching in the course, and will be so helpful. How are they taking that? Because it's at Sydney Uni. It's very academic, but they're also very forward thinking as well.
Very forward thinking. And I think, look, obviously people who pay the money and give up the time, it is only 6-ish hours. It's a little bit more because there's work to be done outside those 6 hours, but 6 to 8 hours, let's say 8-hour short course. It's self-selecting. The people who will participate, who are participating, are self-selecting. What fascinates me and has never ceased to fascinate me in these over 25 years is how utterly simple the relaxation techniques are, and how increasingly complex the research to support these simple techniques is becoming. I mean, in the lab, research is looking at no longer the system or the organ and the cell or the molecule. We're looking at chromosomal activity. We're looking at telomere activity on the ends of chromosomes and inside the chromosomes. Research is investigating the effects of stressors and different relaxation on genetic expression, on the messages that the genes are sending out. And, our genes are sending out messages 24/7. At 15, my genetic expression was stop growing while all the other girls are growing. And then everything that makes us, everything that makes me comes from genetic expression. Give her a wrinkle there, make the hair grow with ice cream, as you said, go grey. These are the messages that our genes are sending out. And we know that stress has an impact on that genetic expression, and so do the relaxation techniques like diaphragmatic breathing and guided imagery. It's a beautiful balance. The techniques are simple. The science is now increasingly fascinating.
Do you think that's a bit of a stumbling block for people, that when the techniques are so simple and people think, oh, something so simple couldn't have such an impact?
Well, yeah, good question. I guess it depends. And this is part of what I teach in a course like at Sydney Uni. How do you apply this clinically? So if you have a patient who says, oh, boo-ha-ha, you know, this is rubbish. It's whether it's too simple, it can't be true, or I couldn't be bothered, or it's, you know, part of being the informed practitioner is knowing what to say, how to convince them. And you always come back to the research. It is undeniable. I quite like that term now, which somebody said this week. The evidence is undeniable, rock solid, repeated, randomized controlled trials that are the gold stamp of research. So I always come back to, we know that this works.
Well, because Ernie Rossi, who wrote the Psychobiology of Gene Expression in early 2001, was talking about that, and he said to me, when Matt's sort of facing this very question, he said it is really interesting, because people were saying your book is so complicated and it's so difficult to read and all that sort of stuff. He said, isn't it interesting? Nature makes the most effective and beneficial processes for our health and well-being so simple. Nature didn't invent research. And it was just a very nice way of saying it, that nature wants it to be simple. And for you to think that nature wanted to do this silly thing,
At the same time, 30 whatever years of study has made me think how incredibly complex the human being, and I no longer talk about the human body or the human mind, but I prefer to talk about the human being. We're discovering the complexities of it all the time. I think you mentioned, Richard, earlier, lifestyle medicine. So relaxation therapy as a therapeutic evidence-based intervention falls under lifestyle medicine. And I know that there are university courses around the world now, medical degrees that are starting to include subjects or courses of lifestyle medicine. And what's more, the students in this university med degree for that subject have to live. So to pass that subject in lifestyle medicine, they have to assess changes in their diet, in their exercise, in their social life, in their relaxation and stress management. And, we've been working towards that for so long.
Yes, we've got to practice what we preach. Yes, I know Alma, the association here, Susie's a fellow of that, and around the world. In Europe, though, this has been a lot more. I mean, psychosomatic medicine was more established, was harder to knock off its perch over there. So there's still quite a lot of talk. Germany and Scandinavia and Italy, there's quite a bit of stuff going on. So this sort of processes of what takes priority is more just an interesting socio-political thing. Or a difficult socio-political thing, because, as you say, the evidence that we've got is undeniable. That just means it was undeniable before. We just didn't have the socio-political mechanism to say it was undeniable.
No. Well, socio-political. We didn't have the extent of hardcore, what I call hardcore science and evidence. I started all those years ago because it was instinctively correct. And that's why I did a master's degree and a PhD, so that I could be that one drop in the ocean of research and make a difference. And we are at that point now. Yes, there's socioeconomic, there's political and financial constraints, but I also believe it's a generational thing. And as I, maybe am at the end of my working life, or the last I mean, I don't intend to give up this work for a long time, but I see the new practitioners, the med students, the nursing students, the yoga training, programs, whatever, all health and medical professionals who are starting out now will take this for granted. They're not going to have a podcast to be convinced about mind-body connections.
I think one of our jobs is we're in the business of translational science, right? We have to translate the science to the client, and
I used to have that as my blurb. I translate science to clinical applications.
Yeah. Because there's a way of describing maybe the correlation between stress and the unraveling of telomeres that would just make people's eyes glaze over. But if we can explain it in a way that is compelling and simple.
And this is actually one of the things, Matt, with Judy's work, done a number of her workshops, and it is, you just sit there and you go, yeah, that makes sense. And it's been I think that's why I think you're one of the best in the country with this.
Thank you. I think compelling and simple. I have strived to explain complex science. I mean, there's a lot I don't understand, and I am no expert in immunology. I am no expert in neuroscience, but my niche market is how PNI provides evidence for relaxation therapy. And if I can take a few minutes, with the onset of more and more online teaching, I know that for a lot of new students who are at university and doing online courses, not just a short CPD course, but doing online degrees, they want the bells and the whistles. They want those extra teaching skills, and that's a generational thing as well. I do know that in 2 hours, experience and feedback tells me that I can tell a captivating story. I can take these complex scientific research outcomes and explain why it is so important in the clinical setting and relate it to relaxation therapy. And that's my gig.
Yes.
So I continue to love.
And you continue to love, and I was very excited, Matt, and I'm very excited to see it out there. So we're sort of getting to a point where we're sort of getting ready to wrap up, and we'll highlight again about the course that's going to be starting in mid-March, and that we'll have links in the show notes and various things, because we want as many people. We want people to get interested in this. We want them to do the course, but even if you're not sure, go and check it out and start thinking about when you'll do it next time. So, so this will be available. But having gone through and talked about a lot of things, what have we missed, Judy? Is there anything? Is there just sort of a roundup that you can give? What can we do?
I think it's exciting times. I've had periods of, and I think I mentioned at the beginning, enormous frustrations where I was knocking on doors saying, look, can we include massage therapy into this course? Can you talk about psychoneuroimmunology to these practitioners? And doors were shut in my face, and interesting but not interested was the general approach. And that is not the case anymore. I do believe that Australia is a little bit too conservative, but it is changing, and there's evidence of healthcare changing. I know that there are medical centres specialising in neuroscience for neurological rehab that have a holistic approach. It's changing. I think PNI practitioners with a PNI understanding change the way they practice, even if it's slightly. Even if it's simply including into the medical history, what do you do for relaxation? When you're really, really stressed, where do you feel it? How do you respond behaviorally? Even if it's 1 or 2 questions that you include into your medical or clinical case history, that is a P&I, more of a P&I approach. It's very exciting times now, and particularly as new people are coming through and will be the practitioners of the 4th, 5th, and 6th decades of the 21st century.
Fantastic. Well, that's a resounding roundup, a beautiful thing. And it's exactly, as everybody knows, we're so keen on the 21st century therapist is just going to be more exciting. There's more for them to look at, but it will become more exciting and more effective. And that is what will make our work more exciting too, is when we feel ourselves supported, as you say, by the evidence, a sense of confidence to proceed the way we're going, and also to be producing these effective things with clients.
Yeah.
Wonderful. Richard, Matthew, thank you for the opportunity to speak about P&I and relaxation therapy.
Thank you so much, Judy, for being with us here on the Science of Psychotherapy.